She's married.
Okay, I think we'll get started. I don't know how long you guys are expecting this to last. I guess I don't know how long it's going to last either. It's kind of odd for me to do ACA, or the Affordable Care Act, and Medicare to try and bunch this all into one meeting. So I'll do the best that I can do to keep you focused on what we need to focus on, and try and keep it somewhat entertaining, as long as make sure you get the knowledge that you need to be able to kind of make some decisions or have some follow-up discussions with me. I know somebody had some time frame issues if they needed to jump in or out a little bit sooner, so I just was told. And if they're...
I'm going at 4:45, so I've got plenty of time.
Oh, yeah, you'll be fine.
Yeah.
And okay, so how many more people are trying to understand how the Affordable Care Act works under 65? Can I get a show of hands? And so okay, how many are interested on how Medicare works? And that's why more they're here. Okay, so great. This is gonna be fun. Okay, second of all, I guess I should introduce myself. My card's Jeff Martin. The card's all in front of you. I am an independent agency. I own ePlatinum Health with my business partner, Frank. We work with the Horton Group, which is the group that you guys get your group insurance from. We are not owned by, affiliated, or make decisions. They just come to use me in situations like this to help educate people. You know, I'm not here to persuade you and try and tell you there's better or not by not going on the group plan or going on the group plan. My job is to give you that information. I am an independent broker, so I do supplements, I do advantage plans, I do the Affordable Care Act. I am not tied to any one company. So obviously, my job is obviously, if it's a good fit, to be able to earn your business that way. But at the same time, my job is really to get you the information as well, okay? I got a little background information on how your plan works. Pretty good benefit as far as an HRA for when you retire, to be able to utilize towards whatever plan you want, which I tell you what, it's much better than a lot of school districts have, because a lot of school districts force you to be on their plan, and they give, their rates are 5 times higher than what you can get on the street market. So there's some advantage with that. The Affordable Care Act, that's a little bit different, right? I mean, I'm sure you guys are really concerned, and that makes sense why the majority of you are here to talk about that. We don't know what it's going to look like. We know what it looks like today. We don't know what it's going to be next year. We don't know how stable. I mean, in my personal opinion, I don't feel it's very stable. The rates are not very stable. There's a lot of good things that became because of the ACA or the Affordable Care Act, but it's not been able to continue on that way. So we'll just see how that works and go from there. Any questions before we get started? My office is in Germantown, so obviously if we get this information, we're not going to give a lot of numbers on exact numbers. You know, with the Affordable Care Act, a lot of numbers depend on what your income would be, and that's going to change when you retire. Whether you have a spouse, the age of that spouse, if you have kids on that policy, those are the sorts of things we get more detailed numbers on. You can call the office line, okay? You'll see the office line listed there. It's underneath my direct line. You'd want to talk to Susan. Okay, Susan is my admin. She's going to set up a meeting with us, whether it's probably half an hour meeting. And basically, if you bring your situation to me and like tell me what your modified adjusted gross income will be for when you retire, the number of people you're going to be on that plan, what you're looking for, I can run quotes in the area and figure out what's some more prices there. So if you're saying, listen, I want to retire at 57 versus 66, we can know if we can make that happen, you know. But again, my concern is I can only look at what this year's numbers look like. I don't know what 2019 looks for. Okay, that's kind of the scary part, especially when you're trying to make a decision whether you're going to continue to work or if you want to retire. I welcome. So that step, if to get more specific information or numbers on your particular situation, you're going to want to call Susan. We can get that. We don't charge any fees, service fees, anything like that to meet with me. Basically, if you do write a policy, I get paid a commission, so that's how I make my money if we move forward, okay? The Horton Group, the school district, does not pay me anything to do this, okay? All right. Medicare. Okay, I'm going to do normally this, just my Medicare presentation's an hour and a half, and then I'll have, yeah, I know, right? It's like, then you guys are definitely buying me drinks after this, because that's the ACA after that. So I'll try and do a high level on both of these. Please ask questions. I mean, I always say somebody's probably thinking the same question next to you. I've been doing this for 12 years. I know this like the back of my hand. So I feel comfortable going through it at a higher rate of speed, but that means you're not comfortable with that. So please slow me down or ask questions, but I'll give you a general idea of how Medicare works. And then we'll talk more about ACA works. ACA won't take that long. So it's more Medicare that tends to be more time consuming. Okay, so you already have all my information, I don't need to go over that again. So Medicare is those for health insurance for people that are 65 or older, or under 65 due to disability, and any age with end-stage renal disease. End-stage renal disease is kidney failure to the point that you are on dialysis. Okay, so your kidneys are functioning at under 17% efficiency, and you have a dialysis machine that you utilize usually 2 to 3 times a week to maintain that functionality. It's administered by CMS, but all the enrollment is done through the Social Security Administration. Okay, those of you that are retiring at 65, but you're not going to take Social Security income, you need to manually go on and enroll in Medicare. Okay, and you can do that a couple of ways. You can go online, which I find is the easiest. I can help you navigate that to enroll. You can enroll by calling the Social Security Administration, or you can go into the local Social Security Administration office. So you got 3 ways to be able to enroll in Medicare. If you're already taking Social Security income, you're going to be enrolled automatically. Okay, they're going to send you your A and B card. That way you can decide whether you want to keep it. So we already talked, okay, we already did that. So basically enrollment, okay? So if you're first turning 65, you have 3 months prior to enroll, okay? Any one of those months you enroll in that, whether it's a Medicare Advantage plan, or a prescription drug plan, that will become effective the first day of the month of your birthday, okay? So even if you're born on the 27th, it always starts the first of the month for Medicare. The only time it's different, if you were born on the 1st, then you actually start the month prior. So if you were born on February 1st, you actually start January 1st. Okay? If you happen not to enroll, or you have a situation where you're enrolling because you had a group coverage through your birthday month, if you enroll in that month, it becomes effective the following month. And you can do that up to 3 additional months after your birthday month. But if you get to the 7th or the 8th month, you'll no longer be able to enroll, and you have to wait for the open enrollment period. Now, most of you will have an exception, okay, especially if you're working. I use you as an example.
Sure.
She'll be 66 when she's going to retire, okay? So when she enrolls, she's going to have a special election period to take Part B because of the fact that she had credible coverage and she was working, okay? You have to be working, and they don't require you to take Part B of Medicare, okay? If you're retired and you're still on the plan for retiree, you have to take Part B of Medicare or you're penalized 10% every year, okay? But in her situation, she works till 66. She basically goes to the Social Security office. I'm gonna give her a form that she's gonna have the employer fill out and say, listen, she's had coverage since 65, she is losing coverage. That gives her a special election period to take Part B of Medicare, so she has no lapse in coverage. What's Part B? Part B will get there. That's Part B of medical, okay? Medical, yes.
My husband,
Hi, husband.
he's on our plan,
Hi,
but
wife.
he is over 66, so when I finally retire, what will happen to him?
They
Will
should,
he do it the same way as Connie?
no, they just take him out back, done. No, so you got that same opportunity. So what's gonna happen is, because he's under your plan and he's been insured this whole time, and are you retired, sir?
From my other job.
Okay, and so you're still working, so because he's under a plan of a person that's actively employed, then what happens is he would have that same special election period. In her situation, he would get a special election period to take Part B at that point. So I'm assuming you haven't taken it at this point, because it doesn't make sense to, because you're a waste of money, okay? And the reason why a lot of people will not take Part B in this situation is when you're under an employee group and there's more than 20 employees on that group, Medicare is a primary. It's secondary. So a lot of times it's not very efficient to do so. Now, if you're under less than a group of 20, it may make more sense to take A and B of Medicare because it would be considered primary. But in this case, no. But yeah, you have that ability to do so. And I will have those forms, so you don't have to take 2 trips to the Social Security office. Call my office, we can fax them over to you, send them over to you, and make sure you get them filled out for that situation. Good question. Here's what the Medicare card looks like. That's going to be changing. I don't know if you heard this. As of April, they're going to start sending out Medicare cards without your Social Security number on it, or your spouse's Social Security number on that. And hopefully they won't still be made of paper, but we'll find out. Okay? So, somebody was asking what's Part B. This is what we'll explain it. And this is the sheet you can take notes on. So basically, when you look at that sheet, there's 2 viable options when it comes to Medicare. The left side, which is a traditional A and B of Medicare with a prescription drug plan and a supplement. And then you have the Advantage plan, which is Part C of Medicare with a prescription drug plan and additional benefits, okay? You can't have both sides, you can only have one. Do you want a sheet? Sure. Does anybody else not have a sheet? I think I got everybody else on one, but there you go, sorry about that. So like I said, there's no right or wrong when it comes to what side you take. It's really what you feel comfortable from a couple standpoints, such as financially, risk-wise, health-wise. Those all are factors that play into whether you would take the left side or the right side. Okay, convenience-wise, those sorts of things. Whether you travel, you snowbird, those are all things that otherwise they're going to cover the exact same thing. It's just the level of coverage you feel comfortable with. Okay, so Part A, that's hospitalization. So Part A is a hospitalization, okay? The first day, there's a $1,316 deductible, okay? That is what they call benefit window deductible, a little bit different than what you're used to. What that means, if I were to go to the hospital today, I'd pay $1,316. If I were to leave and come back 5 days later, I'd pay $0. But if I were to leave and come back 61 days later, I'd pay that $1,316 deductible again. So what that's telling you is it resets every 60 days. Okay, it resets every 60 days. Anything past 61 days, you can see the copay gets a little bit higher. That's your portion, $329 per day. Okay, anything past 91 days, it's $658 per day. Now, I'm not going to try and scare you with these two numbers because in reality, they're kicking you out of the hospital faster than you're being admitted, right? The average stay in the hospital is 2 to 3 days. Okay, so most people are utilizing those first 60 days without an issue. Skilled nursing. Skilled nursing, an example of utilizing skilled nursing would be somebody they're shoveling, they slip and fall, break their hip, they cannot rehabilitate at home, okay? So they would go out to a skilled nursing facility, get rehabilitated with all intentions of going back into their home, okay? The first 20 days are a $0 copay. Anything past 21 days is $164.50 per day. Okay, the average stay in a skilled nursing facility is 17 days. 17 days most people are out. Home health care is kind of the next level down from skilled nursing. Basically, the requirement is under 20 hours per week of skilled nursing care in your home, okay? And you have to, it has to be difficult for you to get to and from the doctor's office. Okay, that's the caveat for that. So basically, physical therapy can be done out of the home, changing bandages, catheters, those sorts of things. You know, one thing that the skilled nursing or home health care is not going to cover you for, they're not going to cover you for care such as bathing, bedding, those sorts of things. So if that's all you're needing, say at the skilled nursing facility you're no longer getting better, okay? At that point, the Medicare is not going to pay for those services. Once you have not made any more progress, Medicare stops paying for that and you're going to be responsible for that. Hospice care, if you're terminally ill, under 6 months normally, basically they're going to make you comfortable. They're going to take you off all your meds, put you on paid meds, make you comfortable. That's also a $0 copay. I don't know if I mentioned it, but home health care is also a $0 copay. First 3 pints of blood, I don't know why they're there. You're supposed to pay for them. I don't know what they cost. So if anybody has that, I don't know if that's per gallon or how that works, but you're responsible for the first 3 pints of blood. Now, Medicare Part A, what does it cost? Nothing as long as you or your spouse put in 40 quarters or more into Social Security, which I'm sure we've all, I mean, I've made it. I'm not saying my age, but young, okay? I'm in my 20s, so just kidding, I'm not. So Part A, no premium. Any questions on how Part A works? Okay, good. Part B, okay? Doctor's visits, preventative care, lab work, outpatient surgeries, which are day surgeries, ambulance rides, durable medical equipment such as oxygen wheelchairs, physical therapy, mental health services, those sorts of things are followed under Part B, okay? There is a premium. If you're under 80,000 or 85,000 and 170,000 for a couple, your premium is $134 a month. If you're above that, there are staggered numbers based on where your income is at. That $134, if you are taking Social Security income, comes directly out of your Social Security check. If you are not taking Social Security income, you are paying for that benefit quarterly. So take that times 3, and that's when you're getting billed for Part B of Medicare. There is a deductible, okay? The deductible is $183 for 2018. That is an annual deductible. So once it's met for the year. You don't need to meet it after 60 days or anything like that. It's met for the year. Then the government's going to pick up 80%. You're responsible for 20%. Okay? Sound good so far? Here's the great thing about Medicare. Okay? Now this is a made-up example. I'm going to give you a real-life example. Maybe something a little more you can relate to. MRIs, $3,000. Okay? I'm sure you guys get a discount of some sort by utilizing your insurance. Maybe you pay $2,000 or $2,500 for that. You know what Medicare approves for an MRI? $400. You know what your 20% is? $80. Okay? So the biggest benefit of being on Medicare, it's the discount you get by utilizing services through Medicare. Okay? That's why, woohoo, I'm going on Medicare should be the exciting part. It's the discounted rates you get. That's what makes the difference. Okay? The only problem with traditional A and B of Medicare is that 20% never ends, and you can have multiple deductibles in the hospital, as you can see, if you're utilizing it every 60 days. Okay? So that's why people will either take a Medicare supplement or they will choose a Medicare Advantage plan to protect them in case they had a bad year. Any questions on how A and B of Medicare works? Okay, I feel like you guys are lying to me. There's a test after this, I already told them, okay? Part D, prescription drug plans. There are 24 different standalone prescription drug plans available in the state of Wisconsin. Okay, the average Part B premium is $42.17. The lowest is $17. The highest is $155.70. That's per month. Okay. In all honesty, when I work with a client, the premium makes no difference to me. Okay. What I do is I go to Medicare.gov. You give me your drug list. I run it on Medicare.gov, and I find the best drug plan based on what you're taking for that given year. What's cool about Medicare.gov is they take the premium, the co-pays, if there's a deductible. They add them all up for you and give you your annual cost for the year. And that's what I'm looking for. I'm finding the best plan, allowing you to use the pharmacies that you want to go to, the drugs that you like to use, and I'm finding the best bet for you for that year. And that can change every year because drug plans get to change. They can change their formulary, they can change their premium, they can change the network that they use. So we usually review that every year, okay? There's a penalty if you do not take a drug plan. So I get this question all the time. I don't take any drugs. Do I need to buy a drug plan? Right. Do you drive like an idiot? Do you still have to take car insurance? Right? Okay. So the idea of having Part D drug insurance is in case you need it. So yes, I'm glad that you're healthy and you've never had any situation where you needed drugs. And the government actually is like, listen, if you don't want to take a drug plan, we don't care. Don't take a drug plan. But if you end up wanting to take a drug plan in the future, you're going to pay for not taking it. Okay. So it's 1% for every month. Okay. So it's based on the national average. So if I went 10 months without a drug plan, I'd take 10% times the 42 and add that on to whatever plan that I have. Okay, so it'd be $4.21. If I took the $17 plan, I'd be paying $21.17. And you'd pay that every month for every year for the rest of your life. Except that number goes up because it's based on the national average. So the thing is buy a drug plan or get senior care. We'll talk about that later. Okay? Any questions on how Part D works? Medicare supplements. Okay? Medicare supplements are managed by state. It's ran by the Wisconsin Commissioner of Insurance. They're all the same. They're all treated the same. As long as you choose the same riders, all supplements cover the same things. Okay? The biggest thing is you want to make sure you do an apples and apples comparison. Okay, so the base plan, they're going to cover the Part B coinsurance, that's at 20%. They're also going to cover the first 3 pints of blood, which we haven't figured out what they're going to cost. I know somebody was researching it on the phone, so we'll know here's showing. And then they're also going to give you some additional mental health, and they're also going to give you some additional home health care visits. Okay? I don't have one client that just has the base plan. Here are the riders that are available in the state of Wisconsin. The Part A deductible rider. Essentially with that rider, you'll have no out-of-pocket medical expenses when you go to the hospital, whether you go 1 day or 90 days. They're gonna pick up those deductibles and those copays per day. You can reduce your premium by going to a 50% Part A deductible, but again, most people take the full Part A deductible. Additional home health care, you know, with what Medicare covers along with additional 40 visits, it's pretty unlikely that you'd ever have that, so this isn't a necessity, but honestly, most people take it because it's usually $1 or $2 a month extra, so people just take it just in case. The Part B deductible, basically they're gonna pay that first $183 for you, or you can save yourself about $40 a month and go down to the Part B copayment model. Okay, I know this is gonna get a little hairy, okay. So what happens with that is you'd have to still pay the $183, and then for every office visit, you pay a $20 copay, and every emergency room you visit, you pay $50 copay. Otherwise, everything's covered at 100%. Okay, so you're taking on a little more risk with that, but you're getting reduced premium because of that. Part B excess charges, perfect example. You guys want to go to Mayo Clinic, okay? They accept Medicare, but they don't fully accept Medicare, okay? And they can balance bill you, the client, up to 50% of the unapproved Medicare charges. That can get pretty hefty. So that's what this rider is for. It's a Part B excess charges rider. So basically, if you go up to Mayo Clinic, as long as you have that rider on there, and if you have all the other riders, you have no out-of-pocket medical expenses to utilize Mayo Clinic. Foreign travel emergency, I'm not a big fan of this rider. It's nice to have. It really is for life or limb only. So essentially, if you go out of the country, you'd have a $250 deductible, and they pay 80-20. Okay, they pay 80%, you pay 20%, up to, I think it's a max of $15,000. Okay, but they're pretty heavy that it has to be an emergency situation. Any questions on that? So essentially, if you put all the riders onto a Medicare supplement, you'll have no out-of-pocket medical expenses. Okay? I didn't run rates up here, but I'm guessing your guys are kind of probably in the 150 range per month. Very reasonable. Okay? And then you have to tally that with the drug plan. But again, if this is what area you're in, call me. I can give you exact quotes. I can give you a number of different companies that you can look at. The other thing I read about there's no network with Medicare supplements. As long as they accept Medicare, you go anywhere where you're at. So if you tend to snowbird, you tend to travel a lot, this might be a better option as far as networks go for you.
So are the rates based on age?
Yes, age. It's age and where your zip code is. So they take that area, they say, okay, Fond du Lac has a high or low rate of usage, or they can determine what that means for them as far as where they go. And then those rates will change every year. Okay, rates go up based on you turning a year older, and two, based on the claims that the group has. Okay, so they can never single you out. If I get cancer, they're not going to raise my rates up by myself. They raise all of ours up a little bit to help cover that cost. Okay, so we obviously start you on, we try and find you on a competitive supplement plan. You don't plan on staying on the same supplement plan the rest of your life unless you've got medical conditions. Most people, 4, 5, 6 years, they're looking at other supplement rates to try and get into a lower cost with the same amount of benefits. Okay, at that time they can ask the medical question to do so. Okay, so they can ask you medical questions to be able to switch to a lower price supplement. And they can turn you down, and then you're either stuck at the supplement that you're at, or you can look at an Advantage plan, which is another alternative. Should run my space here. Okay. I'll just wait. So Advantage plans, the easiest way to explain a Medicare Advantage plan, it's A and B of Medicare being administered by private insurance companies. Okay? Do you guys run your own buses, or are you subcontracted out? Subcontracted. Did you guys ever used to run your own buses? See, where I grew up, they had their own bus barn, they did all the maintenance, they did all that. So they were the Medicare, right? Probably not as efficient, because what were you guys focused on doing? Teaching, right? So what they do is they started subcontracting buses out. So they don't have to mess with the maintenance of the bus, they don't have to mess with hiring drivers and doing all this stuff that really doesn't pertain to education. Same kind of concept here, is what they're doing is it's Medicare paying United Healthcare, Network Health, Anthem Blue Cross Blue Shield, Humana, basically pays them to take care of your medical costs for that particular year. Okay? They have to be approved by Medicare. You're still a part of the Medicare program, but it's ran by private insurance companies. Medicare pays an amount for each member to the insurance companies. The best thing that they have that original Medicare does not is they're all required to have a max out-of-pocket. That means if your copays ever add to that max out-of-pocket, that's your financial security. You won't have to pay any more once that's met for that calendar year. There are network-based plans. There's HMOs, there's PPOs. Private fee-for-service isn't very popular much over here. Those are kind of gone by the wayside. So you do want to check and make sure your doctors are in network, the hospitals like you want to go to are in network. But for any Medicare Advantage plan, they have to treat emergency care or urgent care as a network. So no matter where you're at in the country, a lot of times they cover you anywhere in the world for emergency care and urgent care. But again, you want to make sure you're seeing the same doctors and you want to see, go to the same hospitals you're used to seeing, those sorts of things. So you do want to make sure that they are in network, okay? PPOs can, everybody know the difference between HMO and PPOs? Maybe I should take a couple seconds and explain that. So an HMO is a health maintenance organization. That basically means that they have a set network. You have to use that network unless it's an emergency or urgent care. Otherwise, they are not going to cover you. So if you go outside of that network, you have no coverage at all, okay? Where a PPO, in most cases, you have a network, and you can go outside of that network, right? And you can do so, but you tend to pay higher amounts for that, okay? There's some PPOs that don't, there's some PPOs that do, so it's something you want to watch for, okay? A lot of times the PPOs don't require referrals, a lot of times the HMOs do, but some of them don't. I mean, that's changed, that whole thing has kind of changed over the last 10 years. Any questions on how networks work with these plans? Premiums can vary. They have premium, you still have to pay your Part B premium, which is the $134 a month, but premiums can be as low as $0 a month, and that includes a drug plan, okay? They can be as high as $229 per month, okay? So you're like, well, does that mean the higher premium means the better benefits? Not necessarily, okay? Not necessarily in this particular case. So you want to shop around and see, most people are probably on a 0 plan or a $25 or a $30 plan. That's usually the most popular market they're looking at, okay? And then what happens is they use copays as they use the plan. So instead of they go to the doctor, they pay 10 or 15 or 30, and they go to specialists, they pay as they use it. And then basically, if their copays ever add to the max out of pocket, that's their financial protection. Okay. The biggest thing with the Advantage plans, it's hard to hit the max out of pocket because of the fact that you're under the Medicare reduced rates. Okay, so it's harder to hit the max out of pocket. Most include a drug plan with no additional premium. And some include additional benefits, such as hearing aids, dental, vision, gym. Everybody knows, hey, does my plan have silver sneakers? You guys heard of that? Silver sneakers? Yeah, who doesn't want silver sneakers? Because you know we're going to use it. My business partner, he's 70, and his wife has 5 different memberships, and that's his always thing. It's like, she's got 5 different memberships, she uses none of them, right? So, but yeah, those are available to you. So like, honestly, what's cool about the gym membership, a lot of time if you're here, and then maybe you snowboard, you can use those memberships down there. You have as many memberships as you want. They get reimbursed when you go, so make sure you sign in. Any questions on the Advantage portion? Now we're going to kind of talk about the positives and negatives of each side, okay? Just so you get an idea why you'd be leaning that way. Any questions so far? Anybody bored so far? No? You're lying. Okay. So positives. We're going to run through these pretty quickly to keep you guys, I think I can keep her down to an hour 15, so we're doing all right. Some are all of your out-of-pocket Medicare. So essentially I have no out-of-pocket Medicare expenses, medical expenses, if you have all the riders. Okay, there's no network restrictions and there's no referrals needed. It goes anywhere with you as long as you move or travel within the US. And coverage is guaranteed to you as long as you continue to pay your premium. They can't cancel because you have a bad medical year. Negatives. It's the pay me now method, okay? You're paying that, $2,000 a year, whether you use it or not. Well, if you're only going to the doctor once or twice, that may not be a good benefit for you, okay? Premium goes up each year, like we mentioned before, for you getting a year older, or 2 based on increases due for claims, not just on yours, but the group. Premiums can vary greatly for the same coverage. The program that I use lists all 30 different companies that are available. You'll be amazed. It's like, what's the difference from here to here? No, it's the same coverage, but somebody may be 150 and same coverage may be 250. It's just how they file their rates with the state, okay? So that's why you want to make sure you're doing an apples and apples comparison. Anthem used to send out a flyer that said, oh, you can get a supplement for 80 bucks. Well, yeah, the base one, which nobody adds. So then I get clients that call, well, why don't you put me on Anthem? That's such a great deal. I'm like, well, by the time we added up all the benefits, it was an extra $100 over what they were paying now. So, you know, as long as you're doing an apples to apples comparison, you can get a good idea what the rate should be. It's delayed really bad. Come on. Some have, so the positives of Advantage plans. Some have zero premium besides your Part B premium. You pay as you use it. So if you go with the zero premium plan and you go to the doctor's once, it's 15 bucks. That's all you pay. Great, you save the money in your pocket, okay? Covered for emergencies in US as in network, and there's guaranteed coverage no matter age, health, or financial status. That plan that's zero plan is the same for a 25-year-old that's on disability or a 110-year-old that's on Medicare. Okay, so those benefits, the plans do not change for certain age groups. They're all the same for anybody within that Advantage plan. Many plans include a Part D. Many plans offer additional benefits. Negatives. Plan premiums and terms can change each year. So you want to review that to make sure you're in the best plan each year. So some will change networks, some will change premiums, some will change benefits. Does that happen a lot? No. Advantage plans are set up a little bit differently. You know, with a supplement, if there's a lot of claims being made on a supplement plan, what do? They raise their rates, okay? And if you don't like their rates, what do? You try and move to a different supplement company, okay? There's only one medical question they can ask you on a Medicare Advantage plan. It's, do you have end-stage renal disease? You can have anything else going on, as long as you don't have that, you can join an Advantage plan at all time. Okay, so it's really competitive in that market. Okay, because if that plan doesn't go well and it ends up being a crappy plan, guess what? I just move you to a different plan. Okay, so they want to keep you on that plan and they have a reason to keep it competitive, right? So most companies don't make a lot of changes because they want to keep it standardized that way. But again, if they do, you look at the new plans that come out next year and you can switch. Max out of pocket could be higher than a supplement premium. Max out of pocket around this area is anywhere from $4,500 to $6,500 or $6,700. Okay, if you tend to have a lot of medical going on, okay, you might be better off on a supplement because your max out of pocket is your premium of your drug plan and your premium of your supplement added together multiplied by 12. That's your max out of pocket. Okay, so if you have a lot of medical going on, an Advantage plan may not be a good option for you. That's something you need to weigh. Any questions on those two? Yes?
So can you switch between traditional and advanced in different years?
Yes, great question. So, nobody heard her question? She's basically, can I go from the left side to the right side to the left side, vice versa? What happens, okay? So if I start on traditional Medicare and a supplement and I want to go to an Advantage plan, I can do that during the open enrollment period, which is October 15th to December 7th of every year. Whatever you choose during that period is what starts January 1st. Okay? The only medical question they can ask you is end-stage renal disease. So the answer is yes. As long as you don't have end-stage renal disease, you can go from a supplement to an Advantage plan at any time. You can go from an Advantage plan to another Advantage plan at any time. Okay? If you wanted to go from a Medicare supplement to a Medicare supplement, you can do that anytime during the year. You're not limited to the open enrollment period. But at that point, they can ask you medical questions. They can also ask you medical questions during the open enrollment period. Okay? And they can turn you down. Okay, so what do they turn you down for? Chronic conditions, stuff that's not going away. Diabetes on insulin is a pretty common turn down. COPD, congestive heart failure, dementia, those sorts of things. So that's not going away, they'll tend to turn you down on. Okay? If you want to go to an Advantage plan to a supplement, they have to ask you those same medical questions. And they can so you have the freedom to go from one side to the other, but there's certain limitations. There's medical questions on either side that may stop you from going. Okay. Did I answer your question? Mm-hmm. Good. So when can we enroll in a Medigap plan? Basically, enrollment's 6 months after enrollment into Part B. Okay, that's the open enrollment. That's really, can I ask you any medical questions? Okay. So in a situation where you go and get Part B, you're going to fall into this range here. They can't ask any medical questions. They have to take you. Okay. Now, if there's a situation where maybe you already got Part B, but yet you were on your spouse's plan here, you would fall under guaranteed issue, because what happens is your employer group health plan ends some or all of your coverage, okay? When they drop you off that plan, it's whether your spouse is retiring or not, basically it's involuntary to you, okay? Because you're not choosing, maybe, just keep them on the word, you know. Maybe you are choosing, I don't know. I won't get into that, I get in trouble here. Okay, other reasons that we'd be guaranteed issue to go into a Medicare supplement would be Medicare Advantage plan stops participating in Medicare. So, you know, sometimes those plans are saying, listen, I'm not making any more money, let's just get out. They have to go all the way in 12/31 of that year, and then they can leave that market. But the nice thing is you can go to another Advantage plan, or you can go back into a Medicare supplement with no questions asked. So you have some protections there if something were to change in that market. If you move outside the plan's geographical service area, so you're here, then you move down to Milwaukee, well, that county, now you have different choices. That gives you guaranteed issue to be able to take a Medicare supplement. Okay. Your Medicare supplement company goes out of business. I've only seen this happen one time. I met this lady because of this. She's one of my first clients. They went out of business. That's one of the reasons I will only sell A-rated companies. This was like a B-rated company that went out of business. I will only deal with A-rated companies when it comes to supplements. This is another caveat that you can have happen. So say you go on to Medicare for the first time, you're like, I really like the Advantage plan, I want to try it out. And 3-4 months into it, you don't like it. Okay, you can go to a supplement at any time during that point within the first 12 months. Okay? So if you're on a supplement for 10 years and you're like, you know what, I'm going to try this Advantage plan out, that first 12 months you don't like it, you can go back to the original supplement that you had at the same price you're paying. Or if they do not offer that plan anymore, you can go to a different supplement with no medical questions asked. If you lose medical assistance, okay, that'd be like if you're on Medicaid, forward care we call it in this area. And then if your plan increases from one period to the next, from your group plan by more than 25%. An example where this would happen is say you're on a school district plan and they pay for part of your premium. And then when you get to a certain 5-year period, they're not canceling your policy, but instead of only paying $250, now you're paying $750 a month because they're not paying any portion of that again, but they're not kicking you off. That's where that would fall into. So you'd be able to get a supplement in that particular case. Again, with no medical questions asked. For our Medicare Advantage or drug plans, we talked about this open enrollment period. Again, it's October 15th to December 7th. Whatever you choose as of December 7th begins January 1st. You can enroll as many different plans as you want, but whatever happens, whatever's in as December 7th is what starts January 1st. You can disenroll from January 1st to February 14th. That allows you to go back to original Medicare if you're on a Medicare Advantage plan and pick up a drug plan, a prescription drug plan. That's for those that maybe want to go back to a supplement. They need to get on Medicare. They can do that. Special enrollment period would be a lot of situations with you guys. If you're over 66 and you're retiring, you would qualify for a special election period to be able to get not only Medicare Part B, but also a prescription drug plan, a supplement, or a Medicare Advantage plan. Any questions on the enrollment periods? Okay, we kind of talked about this. I don't want to spend much. Part D, they're going to have a list of formularies and covered drugs. They do have to cover so many generics and so many name brand drugs within each category that Medicare approves. What I mean by categories, whether it's cancer, high blood pressure, cholesterol, diabetes, you know that there's going to be drug, no matter what drug plan you're in, that's going to treat your condition, okay? But maybe it's not as ideal as you want it to be. That's why every year you have that opportunity to change drug plans, okay? So if your drugs change, maybe you drop some drugs, maybe the plan itself changes, you can revisit that and make changes as necessary. I'm not going to spend a lot of time on this because it is complicated, so I'm just going to kind of throw through this. There is what they call a donut hole, okay? And when you're on Medicare, you're going to be subjected to this if you have a lot of expensive name brand drugs, okay? So basically, there's a deductible. If you meet the deductible, you go to stage 2. If your total drug costs reach $3,750, that triggers you to go to stage 3. During stage 3, that's where your out-of-pocket expenses can get elevated because of the cost, especially the name brand drug, okay? And you'll continue to pay that expense until your out-of-pocket reaches $5,000. And then it would trigger you to go into what they call catastrophic, where you have some lower co-pays at that point, and that will continue until the end of the year, and it starts all over again, okay? I don't want to stress too much on that, don't worry about it. when we meet and you want to talk, you want to run your drug plan, I will tell you if you're anywhere near the donut hole. Most people are not. People that hit the donut hole are people that are on insulin, certain name brand drugs, COPD, Eliquis, those sorts of things. If they're a name brand drug, and that's a concern you may have, I'll be able to run it and tell you if you're going to hit the donut hole based on what you're taking. Okay? I don't want to spend a lot of time on that's a really heavy board, or really just like not understanding what I'm talking about. Okay, any questions on that? Who can join Part B? You must have A and or Part B of Medicare. You must live in the plan service area. You cannot live outside the United States. And you must actively enroll to join. The only time that you would automatically be enrolled is if you were on Badger Care or Forward Care, which is Medicaid. Senior care, I was telling you before that you have to either go on a prescription drug plan and get a penalty, or you can take senior care. Okay, senior care is a state pharmaceutical assistance program. You must be 65 years of age or older. It's only $30 a year, okay? But it is based on your income, okay? So if you are in a level 2A or 2B, it might be a good option for you, okay? If you're in a level 3, which I'm guessing most of you guys would be in there, a little word of caution, okay? Yeah, it's only $30 a year, but if you end up needing drugs, it can be pretty expensive in that particular case. Again, come in with your drug list, we can talk about your options and see what makes the most sense for your particular situation. And drug plans are relatively inexpensive, $17 a month. It's pretty cheap insurance. But if you're really concerned with that and you want to do the $30 a year, this does not, if you want senior care for 4 years and you then go on a prescription drug plan for the government, Part B, meaning you would have no penalty. This is considered credible coverage, okay? Just like VA coverage would be considered credible coverage. And your coverage right now is considered credible coverage. So if you're over the age of 65, you're not going to have to worry about that because you've had credible coverage through your employment through the school. Okay, we're going to talk about Medicaid. Go past that. Any questions on Medicare before we jump into the Affordable Care Act? We really smoked through that. Usually there's a lot more questions on this. I know a lot of this isn't important to you, but I wanted to give you a high-level idea of kind of how it works. The biggest thing is you got to, look at it a couple ways. You know what I mean? The Advantage plan may be a good idea for you if you don't use a lot of medical, but the risk is that if you have a bad year, it could be worse than the supplement. So usually what I say is when you talk about this stuff is look at what the co-pays would be, look at what your costs would be with that. Or if you feel comfortable playing ahead, $2,000-$3,000 a year through a supplement, and that's good for you. You know what I mean? You don't have to worry about bills. Basically as long as you go and Medicare accepts it, you don't have any out-of-pocket medical expenses. So those are the things you want to look at to see what maybe makes the best fit for you. Yes.
Does any place turn you down if you have Medicare?
The places, so the question was, does anybody turn you down if you have Medicare? Not all places accept Medicare. We don't have a huge issue with that in the Fox Valley, nor do we have it in Milwaukee, Wisconsin in general. There's not a lot. So somebody asked me today, did somebody bring that up in here? The Cancer Centers of America. They don't accept Medicare. They just don't accept it. A lot of mom and pop shops will not accept Medicare because they don't want to deal with all the billing for the reduced rates. Most of the stuff, the thing that's weird about Wisconsin is most of our hospital systems also employ most of our doctors. So usually when that hospital system accepts Medicare, the doctors all have to accept the Medicare based on that. So no, a lot of times no, you don't have that issue. The other place you'll hear stories of that is maybe in Florida or your Arizonas where there's a big influx of baby boomers or snowbirds as they would call them, and a doctor doesn't want to have, majority of their business revolve around people on Medicare. Any other questions on Medicare? Anybody, if you only need Medicare information, feel free to go. I mean, basically you got all you need. And so otherwise we're going to talk about the Affordable Care Act. Okay, so, and this will not take very long. I'll probably be done with this in 10 or 15 minutes if that. So the biggest thing with the Affordable Care Act was really to be able to provide a higher level of service and guaranteed issue, meaning that they couldn't turn you down for coverage, okay? So I know there's a lot of stuff going on there, and all politics aside, I stay out of that side of it, but I've been doing this for a long time, way before the Affordable Care Act, Obamacare ever came along. And the biggest problem that we ran into it is coverages were not consistent. You could go into a plan, and you'd think you'd have great coverage, everything would be covered, and you find out, oh, they don't cover outpatient surgery, okay? Or, oh, they won't cover you if this You know, I had a person that had a knee replacement, got into a car accident. Guess what? They won't cover the knee, even though it had nothing to do with the fact that, you know, what happened with the knee originally. So they could actually pick out parts of your body they didn't want to cover anymore. You know, like, hey, you had stents, we're not going to cover your heart. The Affordable Care Act eliminated that. They said, listen, you have to take them no matter what, no pre-existing, as long as they've had coverage and they followed and they pay the premium, they're going to cover you, okay? So that's where you see the first one. Premiums for non-grandfathered plans in the individual and small market must be based on a single risk pool. Insurers are restricted to limiting the scope of coverage. So meaning they can't limit, like, before there used to be things like, oh, they can only pay out $1 million in claims. Now that limit has been eliminated. Okay, impact on health insurance premiums will vary by state. Insurers cannot deny coverage based on pre-existing conditions, exclude any pre-existing conditions, or charge a higher premium for individuals with pre-existing conditions. You know, a perfect example is my sister, very healthy, had diabetes since she was a kid. She could never get insured. You know, so she had to go on state insurance, and she's paying a ridiculous amount of premiums and no fault of her own. Okay. So basically, they have essential health benefits. Okay, so basically, these small groups and individual health plans, as of January 1st of 2014, must cover these. Okay, so that means preventative, chronic, mental health, pediatric, maternity, ambulance, emergency, laboratory, prescription, and hospitalization are all the 11. I think it's 11, 3, 6, yeah, 12 actually. They're showing up here. Of the essential health benefits must be covered. It was a way to make sure that everything was being covered by the insurance and nobody was trying to do a slick one by somebody and not say, oh, we're not going to cover hospitalization. They have to cover them. So it's a lot easier to do an apple-on-apple comparison when you're comparing plans when you're on the Affordable Care Act. They're covered in different tiers. They use metal tiers to help explain whether you're in what level of coverage you're in. Bronze, silver, gold, platinum are the 4-tier levels in catastrophic coverage, or for those under the age of 30. Okay. Basically what the plan paid by the plan and what the insured pays. So there are 60-40, 70-30, 80-20, or 90-10. That's the actuarial value of the complete plan. Okay. Tiers serve two main purposes: to create standardized levels of insurance for individuals and small businesses, and to serve as benchmarks for premium credits and cost-sharing subsidies, which we'll talk about. So premium tax credits, okay? So if you're gonna have a conversation, you wanna follow up and say, hey, I wanna know what my numbers are going to look like and what my premium's gonna look like for me or my spouse, or just me because my spouse is on Medicare. What you're gonna need to have for me when you call Susan to set up an appointment is I wanna know what your modified adjusted gross income is for that tax year. Okay, so if you need coverage this year, I need to know anticipating what your income's gonna be for 2018. Based on that income determines how much of a tax credit you're going to get based on your income and the number of people on the plan. Okay. Now, how that works is if your income's at a certain level and you said, okay, this is what I'm going to make, and they say, listen, the government's going to give you $1,000 a month towards your premium. Okay. And then you end up making more than that, you're going to have to pay back a portion of that $1,000. If you make less than that, they're going to give you more money back in taxes. It's all reconciled through your taxes, through your 2018 taxes, okay? The thing you got to be aware of is if you really underestimate what your taxes or your money's going to be and you go way over the fact that you owe the whole thing back, especially when you're in the 50s and 60s for your age range, you'd be paying $12,000 back in taxes if you overestimate. I had a couple, really nice couple, they were kind of, they could see how much they got out and they were under and they were getting like $1,200 in tax subsidy. Well, the wife, I'm sure it was the wife, maybe the husband, throw me under the bus here, wanted a kitchen remodel. So they took it out of their IRA, about $60,000 worth. So guess what they owed back? Every single penny, because they now put them over the wrong tax bracket. And they just didn't even realize it until the tax man was like, oh, that was probably not a good idea, because then they owed that all back. Okay, so that amount was $72,000 instead of $60,000. Okay. So things you want to think about when you're making those decisions, right? Yeah, I'm sure it was the husband. He was, yeah, who does husbands love good-looking kitchens. Okay, so assistance is made through payment through health insurance, available only to individuals who purchase health insurance through the marketplace. That's the premium tax credit portion. Okay, In all honesty, there's really no on or off exchange per se in this area. Before, when you first did this, you could only buy on exchange, and then you could go off and change and maybe have some other choices. Pretty much everything that's on exchange is off exchange and vice versa, okay? People are like, well, there are other options besides here. Not if you want to avoid the penalty that doesn't exist anymore, okay? So we'll talk about the individual mandate here in a second. Premium tax credits are determined on an income-based sliding scale, drawing on the taxpayer's last return. It's probably not true that way. It's basically, they figure it out based on what you assume it's gonna make. But if you're saying, say you made $100,000 this year, and then next year you go in there and you say, I'm only gonna make $20,000, the government's gonna say, okay, what's going on? They'll ask for proof. But if you tend to be pretty close to what you made, but a lot of times in your situation with your retirement, your income is going down quite a bit. So they usually ask for proof, like check stubs or retirement statements that you're saying that you are gonna have a lower income for that year. They're based on the premium cost for the second lowest cost silver plan in the marketplace, servicing the individual. It's not really, and basically if you're between 100 and 400% of the federal poverty level, you're gonna qualify for a premium tax credit. And that changes whether you're a single, a couple, or a couple with children. Any questions on that? I know it seems really complicated. I make it really simple. When I quote it, I'll tell you how much subsidy you're getting, what your premium would be, and we'll be able to look and see what your benefits are going to be. So I know this is probably a little deeper than we needed to go, but this is really the best way to word it. I mean, I guess I wouldn't know how to word it much better. The other area is what they call cost-sharing subsidies. So basically, if you're getting a subsidy, you may qualify for what they call a cost-sharing subsidy. That means if your income is up to 250% of the federal poverty level and then lower, you actually get help with your deductibles, your co-pays, and those sorts of things. So that can make a huge benefit for some people that are utilizing and not having very much income and yet do not qualify for Medicaid or Badger Care, as we call it here in the state of Wisconsin. So let's see, I think I need to hit here. Health insurance and marketplace investment. Oh, I can, like I said, I'll be able to tell you if you qualify for cost sharing. But the biggest trick to cost sharing subsidies, it is only applied to silver plans. So if you're like, oh, I qualify it, but it doesn't change my deductible on the bronze plan, that's because it won't. It's only going to change those things in the silver plans only. Okay, it won't change them on the gold or platinum either. It's only the silver that the cost sharing subsidies will apply. That's all I got. Any questions on how this works? Ooh, I see a lot of blanks here. You guys want to run an example? You guys want to run an example really quick? I'll just make some stuff up here.
Do you have information on the new state plans that are available to us?
Through the employer?
No, they're not through the employer, they're through the state. The ETF, if you are a state employee, because we're state employees,
Yeah.
we now, it's brand new. So we
Okay.
can buy into a state health plan.
I don't, and I don't know how the rates are on that or anything like that.
Okay, because that's available to us now,
Okay.
too. So we were,
Yeah, I wish I would have, yeah, I don't have any information on that. I don't know when that started. I know we had some people that got kicked out the plan, they could go in there. And there are some people that if they had WEA before, they could go onto that kind of stuff, but.
and
they tend to-
WA is part of that, from what I
Yeah, they
understand?
tend to be, from what I saw for premiums, the individual may be something looking as far as the Medicare side, they tend to not be very competitive. Because if you're talking about the same one that I'm thinking of.
No, this just happened.
Yeah,
Like,
it's because they kicked a bunch of other people off of one plan and then they went on to these options. Because I helped a couple people that were already retired and they were in the teacher situation and they had to go on and choose these new plans. From a Medicare standpoint, I know they were very expensive month to month. I don't know about the individual side. I don't know. I remember there's a state-based plan where they got rid of something and exchanged it with this, and then there was different ones. It wasn't just WEA, there was other options like
Right.
public health and those sorts of things. You do a number of different options. On the individual side, I don't know how competitive they were. But again, I can be able, if you can find out the information on that, I can come back and quote you based on what you think you get. But again, you guys get money to be reimbursed on, so too. So obviously, yeah, shop around. As long as it's considered credible coverage, you should have any issue with that. Obviously, before, so what's happened is now is the individual mandate was if you don't have credible coverage, you're penalized based on that, okay? That law is still in effect. What happened is President Trump has basically told the IRS not to enforce it, okay? Okay, so that individual mandate is still there, it's just not enforceable. So what it won't be is it won't be penalized against your taxes. Okay, so there is no more, I can't say that there's not an individual mandate, because there still is. It's just the people that enforce it have been told not to enforce it. So essentially, if you do not have health insurance, normally you would get penalized, you're not going to be penalized for 2018, because they're not enforcing it. The law is there, just nobody's enforcing it. It's like having a speed limit. Go on, as fast as you want, nobody's gonna pull you over.
You know when you
what I
can
mean?
drive the next.
So that's how that was. I want to bring that up because that is a difference. So there are some other options outside of this. We can talk about, there's a Christian sharing plans. There's a lot of other options out there. But again, only the Affordable Care Act are going to give you those mandates. We're going to be required. They're only going to be held to that standard. Other insurance companies, beware of going on short-term plans. Okay, I got a lot of people that say, well, I went on a short-term plan. It's only $300 a month versus $900. The problem is they can only put you on for 3 months. And then after that, you have to answer medical questions. Well, if you get cancer in month 3, you think they're going to take you in month 4? And then guess what? You have no insurance for the rest of the year. Okay? So the other thing with the Affordable Care Act, there's certain enrollment periods. Okay? It's November 1st to December 15th for January 1 effective dates. Okay? If you want to change your plan or get onto that plan, you need to do it during that period. If you do not do in that period and you do not have a special election period, such as losing your employer coverage, okay, you can't get on in the middle of the year. Okay, so like if I said I don't want to go into insurance because I'm healthy, and then in July something happens to me, I don't want to get insurance, they're not going to take you. They don't have to. Okay?
What were those dates again?
I'm sorry.
What were those dates?
Oh, November 1st to December 15th.
So do these plans run January to January?
January to December 31st. They're all calendar years, same as Medicare. Great
Okay.
question. Yep.
So our insurance goes through the end of August.
Right.
So then we can jump on?
Yeah, you can jump on any time during the year as long as you have a qualifying special election period. In this case, you would. You'd be like, because your coverage stops. You can COBRA out. Oh, that's a good question, because I believe you guys can COBRA out if you choose to, right, as I understand it. So there's a couple things you need to know about that. If you decide to COBRA, okay, there might be a couple reasons why you want to do that. If you're in the middle of the year and say you've met your deductible, probably makes sense to COBRA out the rest of the year, right? Okay, or the next 18 months, I'm not sure. But you can't COBRA out 3 months and then decide to go on Obamacare, because it's not a loss of coverage. You can only make that choice when you're losing your coverage at that point, okay? But then you can make that decision again during the open enrollment period, that November 1st to December 15th. Does that make sense? Okay, so you can make that choice. So you don't have to, you're not forced to run out to your 18 months of COBRA. You don't have to, but you can only make that change during the open enrollment period, which is November 1st to December 15th. Does that make sense? Yes.
So if you opted to do this COBRA and our insurance ends August 31st, so you start, and you have this, you start with September, if you went 18 months, that would take you to the end of February. So March 1st, you're sort of in no man's land, right? Because you have no enrollment.
Right, well you could, because you have a special election, because now that's a loss of coverage because you're losing COBRA.
Okay.
But what you can't do is you can't go 6 months on COBRA in the middle of the year saying, no, I don't want to. But here's what you could do. You could start in August, right? Did you say August, right?
Well, I think September 1st, when you're on your own.
So September 1st. So say September 1st you lose coverage, you're like, okay, I'll COBRA September, October, November, December. As long as you enroll from November 1st to December 15th on the Affordable Care Act, it will start January 1st. So you're okay there. But what happens is that if you end up COBRAing out 18 months and you're in the middle of the year, you'll have a special election period. You just need to enroll in a plan within 30 days. But your risk is you may have another deductible to worry about. So that's the stuff you kind of want to analyze. Does it make sense for me to go through, or am I better off, instead of going through 3 months, would I be better off saying starting fresh and go on the Affordable Care Act and start there and have a full year versus risking if I have a bad year in the first 3 months and then I have to switch, guess what, I'm starting the deductible all over again. So those are the things that'll help you walk through and say, okay, well, where are you at? Are you concerned about this? And what the cost savings is one way or the other. And that's really what you want to analyze one way or the other. I mean, honestly, if you're telling me you're going to rely on, in August you said you were going to retire this year, I'd definitely tell you to COBRA, because I have no idea what this is going to look like next year. It doesn't look good. I mean, what I see rate increases at and where everything's at, I have my own opinion on where this is going, and it doesn't look promising. Okay, so it's kind of a scary time for you guys, especially if you're looking to want to retire and you're looking at how is this going to look. Medicare, pretty safe. Not too worried about it. Not really worried about it. But if you're looking to retire and you're well under 65, I'd be a little concerned if I were in your shoes. I am for a lot of my clients, so, hey, believe me, there's a lot of celebrations going on when you say you're almost turning 65. It's like, woohoo! You know, so, does anybody want to see any rates or have any other questions? I can throw you up some ideas if that'll help at all.
How does the insurance till 27 for our children? When does
Oh,
that?
26, so once they turn, yeah, 26.
Once they turn 27,
Yep.
they're done, right?
No, once they turn 26, they're done.
Oh, I thought they got it while they were 26.
No, gone at 26.
Oh.
Once they turn 26.
Tell Brian you better have insurance.
Right.
Okay, so let's
So
hold on.
does that mean right on their birthday, or are they covered for that
It
month?
depends on the insurer, okay? Because I've gotten it both ways. I've had it, they can't kick them off fast enough. They'll it's the 12th and they're gone, the 12th of the month and they're gone. A lot of times they'll do it to the end of the month. It depends on the insurer. And I don't know why the government even lets them deal with that, because Obamacare, the Affordable Care Act, it only starts on the 1st of the month. So if you get down at the 12th, I either have to overinsure you for 12 days or not insure you for the rest of the month, because it won't start till the 1st of the next month. Yeah, so it depends on how the insurer looks at it, yes.
My son's 26, and he's on.
On your plan?
And he went to his employer and said, do I need to get on now at the open enrollment? He goes, no, you wait until you're gonna turn 27.
Well, maybe, am I saying this wrong? Maybe, let me just double check, maybe I got my facts wrong. Healthcare. Let's just check. Yeah, plan covers that can be either kept until they turn 26 years old. Until you turn 26. See, I didn't know what I'm doing. You had me second guessing myself for a second there. I was like, wow, maybe I did misspoke, but yeah. Yeah.
You have to recheck.
Yeah, that'd be great, okay. Until you turn 26. So once you're in your parents' job, and this is off of healthcare.gov, so this isn't me making this up. In most places, you can stay on it until you turn 26. Generally, you can join a parent's plan and stay on until you're 26, or even if you get married, blah, blah. Now, if that employer allows you to stay on it, that's just what the mandate is. If that employer says, listen, we'll let you stay on until this or that, that can change. He's probably 25, but it's okay.
And Beth, you teach math.
I'm so confused with my kids.
So, does anybody want me to run a quote? Does anybody want to throw me some, I mean, I can mess around with it. Do you want to just give me a zip code? 54937. And these rates are good for that year. Okay, so these rates are, if you're going to enroll, whether it's January, February, March, anywhere during the year, you know those rates are going to be good until December 31st. Okay, so on the quoting software that I use, we'll throw in an age. Anybody want to give me an age? Okay, 62. Smoking does make a huge difference. Let's add a dependent. How old does your dependent want to be? And don't say like 34. No, I'm sorry, 34. I meant a spouse. I'm not a spouse. Don't make her more. 63. Any kids you want to add on there? Okay. So basically, so here you can see that you have a couple options. Actually, here's all the options that you have in this county. Okay, you have Common Ground. Okay, Dean Health Plan and Unity Health Insurance. So those are the three insurance companies that you have options to join. Okay, it's what's based in the county that you live in. Okay, and you can see the premium, pretty ridiculous, right? You can see this here, right? HSA, $1,700 a month with a $6,550 deductible. That's per person. Okay, with a max out of pocket of $6,550 per person. Okay, so those are the things you want to look at. Now, that seems scary, right? But now you're retired. Let's just say you're only going to make $50,000 a year for the two of you. Okay? That same plan is now zero premium because the subsidy is $2,000. Okay. We can go to silver plans. Let's see if there's a cost sharing reduction. If we jump over to silver plans, okay? You're looking for a $3,200 max out of our deductible per person with a $7,350 max out of pocket per person for only $392. That's pretty reasonable, okay? And you're looking at, guess what, $30 office visits, $60 specialist visits, $15 generic drugs, okay? So, you know, depending on where your income is at, I mean, yeah, I want you guys to make lots of money, but that does make a difference in where you're gonna come in there, and it really can be scary. I mean, at 17, that's 17,000, that's almost $20,000 a year in health insurance if you had no subsidy. And that's not a very good plan, right? So, again, there's no fee for me to go over and run these quotes for you. You can see how long it took me. It took me like 20 seconds to run a quote. I mean, give me a call, we'll give you some numbers. You know, maybe you have to work a couple of years, maybe it'll be good, maybe you can retire. I hope it's the later, but that's kind of where we're sitting with that. Any questions up there? Yes.
So if he's on Medicare, and I have to do this, do I have to take his income?
Yes, unfortunately you do. You just gave it away that you're making lots of money, so I don't know if that, I know. Dang it. But so yes, so basically, you do have to file a joint tax return, okay, and it's based on the couple, whether one of you is on there or not, okay?
Is that
So,
monthly premium for the couple or?
yeah, this is for the couple, and this was a couple, this is couple. So in your case, watch, if I pull,
But the deductible's not.
the deductible is, yeah, it's per person, yes. So watch this. If I just take off the 63-year-old here, it's really not that much of a difference in premium. It's still $395. So when you drop one person off, it tends not to help out that much. That's because you can see your subsidy went down from $2,000 down to $788. So it kind of offsets that a little bit.
Okay, what if you have a daughter who's like 25? You don't have to include her income with your.
Only if you're claiming her. Are you claiming her? And if you don't, and a lot of times I'll have it to people like, you're better off probably not claiming your kid, okay, in that case. It's gonna help them out. Because basically it'll be based on their income on their tax return. Okay, so if they're only making $15,000 or $20,000, starting out, they're much better off going on it by themselves because they're gonna have an amazing plan. They'll be paying like $20 a month and have a max out of pocket of $2,000. And you can manipulate these numbers, guys. So if you're determining how much your IRA is coming out, you can change how much that is. You can really control this. And I had a guy that was making $300,000 a year, and he was only paying $100 because now he had a bunch in savings, or he took a bunch out before, and then his 2018 tax return, he was making no money. I mean, he was making $20,000, so you can play the numbers a little bit too. You can be creative with your accountant. I mean, it's all legal. You're not doing anything illegal. Okay. Any other questions on this?
This isn't on that, there's
Awful. Everybody hates me.
what is,
Everybody's going to be working for a long time. As far as I don't think you're going to have a choice, but they're going to be mad at you this whole time. Okay, they'll be like, seriously, I can't.
I'm not the fan, all right? No, thanks for coming.
yeah.
Go ahead, sorry.
Another teacher had a question, what is major medical, does that still exist? Is it something that?
Yeah, I mean, it's just basically just a play on major medical, and it's not only is this major medical, but it's going to have to cover those essential 11 benefits. I mean, it's just another way of saying it, but they're guaranteed those are. Major medical can be, can be construed as different things, whereas this has to cover the 11 major things that are in there, the essential benefits is what they call it. Of course, major medical could have just been considered maybe hospitalization, but not outpatient surgery and those sorts of things. You see the little gray areas with that, whereas when you're saying it's the Affordable Care Act, you know that it has to hit those major 11s. If it's not showing up on this screen on the left-hand side, it's not the Affordable Care Act. Okay? Yes, you're welcome. Yeah, that was pretty quick. We did good.
Can I have one more question?
No. You have to tell me, oh, it's you person.
Per time at Starbucks, do you still get home subsidy?
You'd have to ask Starbucks. I've never been employed by them, but I don't believe so. So, I mean,
Well, I thought it was over 20 hours.
Yeah,
Here it comes, Starbucks.
it's over 30, so, well, it depends. So here's the deal with this. So this is important for you guys to know. The other thing is if they offer you health coverage, even though at your employer, even though it may be considered crappy, if you're trying to get a subsidy and they offer you coverage to your employer and it's considered affordable, and I say affordable like this because I know affordable means different things to different people, you have to take it. Okay, you have to take it. Now, if you want to go on here and pay the full price, okay, then that's fine. You just cannot get any subsidized rates at that. Okay, does that make sense? Okay.
Thank you.
You're very welcome, guys, thank you. Again, this is supposed to give you a high level, maybe scare you a little bit, I don't know if that's what their intention was. But basically, this will give you some things to think about. If you want specific numbers, just call Susan, she's great, she'll set up a small 30-minute phone appointment, I can give you exact numbers based on there. You kind of know what you need to bring me, who's gonna be on the plan, what you expect the income to be, and I can give you an idea what these numbers look like, okay? Okay, that's it. Thank you.
Thank you.
I'm gonna turn off